Hello again from Orana Veterinary Service and Central West Canine Breeding. Today's topic is worms, how they affect your dog and how to prevent problems occurring. Specifically, we will talk about enteric endoparasites, worms that live in the intestine of your dog. There are four main types of intestinal worms in dogs. These are the roundworm, hookworm, tapeworm and whipworm. To understand the effective control of these parasites, it's important to understand their life cycle and what things you can do to break that cycle, as well as using regular worming. How do you know if your dog has worms? You probably won't know, but he or she probably has worms. It is often as simple as taking your dog for a walk, and hookworm larvae can penetrate the foot pads and webbing and establish an infestation. You may not see worms in your dog's feces. A fecal flotation test to check for worms at the clinic is recommended periodically. However, not all worms lay eggs each day. Whipworm, for example, may pass a large amount of eggs over a few days, then none at all. So let's consider the life cycles of the four main types of intestinal worms. Understanding the life cycle helps to understand and provide a preventative and control program for your dog. Roundworms are a very common parasite of the small intestine in dogs. In heavy infestations, you may see coiled spaghetti-like worms in your puppy's feces. They may be between 6 to 16 centimeters in length. Large roundworm burdens may cause intestinal obstruction and even death in young puppies. The roundworm life cycle is complex, but it is important to understand for proper control and to minimize the risks for yourself and your children. Starting with an affected dog, roundworm eggs are passed in the feces. The eggs hatch, releasing larvae, which contaminate the grass and may subsequently be eaten by the dog. The larvae may be eaten by rodents, and if a dog eats the rodent, the life cycle completes through an intermediate host. Larvae may also be ingested by humans, particularly children playing on the grass, and the larvae can damage the eye or internal organs in humans. Larvae may be ingested by a brood bitch and migrate to internal tissues, including the uterus and mammary glands. The larvae of Toxocara canis passes through the placenta in the pregnant bitch, ensuring the developing pups are born already with a complement of roundworms. Newborn pups suckling milk from the bitch ingest further worm larvae to add to the worm burden acquired before birth. As they grow, pups ingest worm larvae from the ground or bedding, further adding to the uptake of roundworm larvae. The pup grows to an adult and is exposed to many sources of roundworm larvae, ensuring the worm life cycle completes efficiently and roundworm survival for the next generation. The importance of worming the pregnant bitch at least 3 times during the pregnancy is critical to reduce the risk for the developing litter. The female roundworm may produce up to 200,000 eggs per day. With several adult worms in the intestine, millions of eggs may be passed each day. The eggs stay on the ground for 10 to 14 days before becoming infective. It is essential then to pick up feces regularly to minimize contamination of the environment and reinfestation. So what do roundworms do to my dog? Puppies may die from a heavy roundworm burden, as they may obstruct the intestine, causing bloat or even perforation of the intestine and sudden death. Roundworms cause ill thrift as they absorb nutrients from the ingested food. Inflammation of the bowel may cause the affected dog to lose weight, have a dry coat, and have a pot-bellied appearance. Vomiting and diarrhea occurs in heavy infestations. Larvae migrate through the lung tissue in newborn pups, causing a cough or even pneumonia. Roundworms are also a risk as a zoonosis, a disease of animals that can be transmitted to humans. Children are particularly at risk as they often play with their dog or puppy and don't understand the importance of hand washing after playing. Roundworm larvae may be ingested after patting the dog or touching grass where the dog has defecated. Ingested larvae migrate through the lungs, liver, brain, or even the eye, causing severe inflammation in these organs and even blindness. Good hygiene is essential to prevent human infection. Hand washing after playing with the dog and before eating is essential. Do not play in areas where dogs regularly defecate. We will discuss other zoonoses in another episode on Orana Vet TV. Hookworm is a common intestinal parasite of dogs. They are small, thin worms up to 1 centimetre in length, and despite their small size, may produce up to 20,000 eggs per day. An infestation of 250 worms is not uncommon, and several million eggs may be produced daily. They are common in regions or seasons of high temperatures and high humidity. The larvae can persist on the ground for up to 7 days in favourable conditions. Their life cycle doesn't complete when the ground is cold. Let's look at the hookworm life cycle. Starting with an affected adult bitch, eggs are passed in the feces in periodic amounts, in large amounts also. The eggs hatch on the ground, grass or sand, and undergo maturation to an effective third stage larvae. The larvae have the ability to penetrate skin of all mammals, particularly dogs and humans. In humans, a local skin rash may initially be evident, but may progress to abdominal pain, diarrhea, weight loss, and even anemia. Another zoonosis to be aware of: larvae can penetrate the skin and foot pads of dogs, as well as being ingested from contaminated soil or grass. The larvae mature to adult worms in the dog, and in turn hookworm eggs are produced from female worms and pass in the feces. In the pregnant bitch, larvae cross the placenta and infect developing pups before birth. They also locate in the mammary tissue and are ingested by the newborn pups while suckling from the bitch. In turn, the larvae mature to adult worms in the pup and produce eggs which are passed in the feces, completing the cycle. Hookworm is incredibly adapted to ensure its survival and replication. So what do hookworms do to my dog? Hookworms suck blood from the wall of the small intestine and release an anticoagulant which prevents blood from clotting. Black or bloody stools are usually seen. Affected dogs usually have bloody or tarry diarrhea, weight loss, anemia, a dry coat, and poor absorption of food. A heavy hookworm burden may be fatal, particularly in puppies. Hookworm feeds on the dog's own blood and may cause suppression of the immune system. Whipworm. Whipworms are larger parasites, 4 to 7 centimeters in length. They live in the cecum and large intestine. The adult whipworm produces eggs which have a thick capsule, and these may persist on the ground for more than a year, even resisting freezing. An affected dog in a confined yard has a high risk of reinfection if pickup of feces isn't done regularly. Whipworm have a simple, direct life cycle. Eggs are passed in the feces and the larvae emerge. The dog ingests the larvae from the grass or ground, and they move to the large bowel and develop to adults. What do whipworms do to my dog? If only a few adult worms are present, there may be no clinical signs. A larger worm burden will inflame the large bowel, and soft feces with blood and mucus is usually present. Intermittent diarrhea and weight loss occurs. Whipworm damages the bowel wall, allowing bacteria to enter and grow, producing an intermittent bacterial diarrhea. Often the diarrhea is treated successfully, but the underlying whipworm cause of the diarrhea persists, if not properly identified. Tapeworm. There are 9 types of tapeworm that affect dogs in Australia. However, the same treatment regimes are usually successful for all. We will discuss the 2 main types of tapeworm that both have significant implications for serious infection and possible death in humans. Another zoonosis risk. The flea tapeworm, Diploidium caninum. The flea tapeworm lives in the small intestine and may grow to a length of 50 centimeters. Let's look at the indirect life cycle of the flea tapeworm. Segments of the mature tapeworm break off and are passed in the feces. They may also be found around the hair coat and skin of the dog's anus, similar to a grain of rice in appearance. These segments are irritant, and as they move they may cause the dog to exhibit scooting behaviour as it drags itself along, rubbing the area under the tail. Chronic cases may show hair loss around the base of the tail and the points of the pelvic bones, the result of chronic rubbing. Tapeworm eggs are ingested by flea larvae. The flea larvae grow to an adult with the tapeworm inside. The infected flea is ingested by the dog during regular grooming and passes to the stomach. As the flea digests, the tapeworm larvae are released and grow to adults. At times, an infected flea may be inadvertently ingested by humans, particularly children. What do tapeworms do to my dog? There is little clinical effect in dogs apart from itchiness around the anus as squirming segments irritate the skin. Large numbers of worms may cause diarrhea, bile reflux, and abdominal pain. Hydatid tapeworm, Echinococcus granulosus. The hydatid tapeworm lives in the small intestine and is only 5 to 6 millimeters in length. This tiny white tapeworm may live up for 2 years in the dog, and the main concern is the terrible disease that can occur in humans, the result of inadvertently ingesting hydatid tapeworm eggs from a dog. Should cysts develop in a human, there is no medical management, and extensive surgery is often the only option. Hydatid tapeworm life cycle. The normal life cycle involves the adult hydatid tapeworm in the dog's intestine, passing eggs which may be ingested by sheep, cattle and pigs. Hydatid cysts develop in the internal organs of these animals. If dogs are fed offal from farm animals, particularly liver, kidneys, intestine, they may ingest the hydatid cyst, which re-establishes the hydatid tapeworm in the dog's intestine. Should the tapeworm eggs passed by the dog be eaten inadvertently by a human, hydatid cysts may develop in the liver, brain, kidney, lungs, with catastrophic effect. Hydatid disease is a very serious zoonosis and can be eliminated by adopting procedures to stop dogs eating offal. The incidence of infection in Australia is reducing as a result of education. However, free-running wild dogs still pose a risk. What do hydatid tapeworms do to my dog? Dogs have been reported with up to 100,000 hydatid tapeworms in their intestines, yet showing no signs of any disease. The primary concern with hydatid tapeworm is the zoonotic potential for humans. Hopefully you now understand a lot more about worms and the risk they pose to your dog or puppy, and even you. Prevention and control is essential for optimum health, and this is achieved in several ways. Parasites are uniquely adapted to ensure their survival. The incidence of the zoonoses we have discussed is quite small, but nevertheless devastating and possibly fatal for those that are affected. It is important to maintain a clean environment with regular pickup of feces. This reduces the reinfestation risk in enclosed environments. Hand washing and hygiene after patting or playing with your dog is essential. Worm larvae, particularly hookworm larvae, survive very well in moist sand. Children should not play with puppies in the sand pit at home, as this area can become highly contaminated with worm larvae. Even dogs at the beach also pose a risk to beachgoers just walking over the sand, as larvae can penetrate the skin of the foot. To determine the best worming program, it is important to understand the concept of a pre-patent period. The pre-patent period is the time from when the dog ingests a worm egg to when that egg has matured to an adult worm and in turn capable of producing eggs. Remarkably, in hookworm, the pre-patent period may be as short as 2 weeks. Consequently, the recommendation of the Australian Companion Animal Zoonosis Advisory Panel is worming every month. In the past, it was recommended to worm your dog every 3 months. This doesn't provide a good parasite control with, for example, a 2-week pre-patent period with hookworm. Regular worming is the essential key to success. There is a plethora of worming preparations available, and the practice manager at Orana Veterinary Services will detail these in a subsequent episode. Hookworm can be of particular concern in greyhounds. Their lifestyle of regularly congregating at race and trial tracks ensures more exposure to hookworm larvae. Greyhounds may require an injection for hookworm control. Speak to our vets at Orana Veterinary Services for the specific management of hookworm in greyhounds. If you are using a tablet wormer, it is good to practice rotational worming, swapping brands with a different active ingredient every 2 months to reduce the likelihood of resistance issues developing. It is important to worm pregnant bitches 3 times during the pregnancy, ideally 2 weeks after mating, then at week 5 and again at week 7, then again 2 weeks after whelping, then 3 weeks later. Newborn puppies should be wormed at 10 days of age, then every week to 6 weeks, and then fortnightly to 16 weeks of age. Despite all the procedures we have mentioned, a clean environment, hand washing, good hygiene, and regular monthly worming, it is recommended that you have a fecal flotation test done annually at the clinic to check the effectiveness of your worming procedures and protocols. Only a small sample is required, and the tests can be done while you wait and pick up a container from our clinic to obtain the sample cleanly and easily. We trust you have a better understanding of canine intestinal worms and how well adapted they are for their survival and proliferation. Until next episode on Orana Vet TV, stay healthy and enjoy your healthy dog.